This is Joe Mullings from 160 Studios in Delray Beach, and today on our MDIC series, I've got Timothy Stenzel, who is the Director, Office of In Vitro Diagnostics and Radiological Health at the FDA. Tim, thanks for joining us. And I've got Danelle Miller, who is the VP Global Regulatory Policy and Intelligence at Roche Diagnostics. And Danelle, thank you so much for joining us. We've come out of something, or we're not quite out of it yet, but as a world and a nation, we've gone through one of the most dynamic periods in generations. And in so many categories, whether it's medical device, social, food, beverage. But I'm imagining there's been a lot of changes that have taken place. And in the IVD world, which both of you are leaders in, the business and policies around them have changed. So Danelle, from your side, how do you view the perspective of the IVD world before March of 2020 and as we emerge out of this today? What are your general overviews and takeaways?
Thanks so much, Joe, for the question. I think one of the things that the COVID-19 pandemic has really done is shined a light on the value of accurate and reliable diagnostics. You know, as we move forward, there's no question diagnostics are going to have a huge role to play, particularly in personalized medicine. And those diagnostics need to be accurate and they need to be reliable. And so as we look back at the pandemic and the intensity around having to have multiple different types of diagnostics at different phases in different places to reach all of the various people, there was still this theme of all of these people deserve accurate, reliable diagnostics. And I think that's what we're going to see play out in the future. The other piece that I would add is what we've seen is an absolute blossoming of technology. You know, things that may have been in the pipeline, products that may have been used in other areas now became used in the diagnostic realm. And we're going to see, I think, a growth in that exponentially over the next few years.
Tim, you want to add on to that with what Danelle shared?
Yeah, I mean, Danelle said it very, very well, I think. I completely agree. We've seen companies pivot from, say, doing, other infectious disease. They've never been in the respiratory disease space, and they jumped into it with the technology that they hadn't even launched yet. And we have seen a tremendous number of newcomers to IVD space during this pandemic. And the innovation has been clear. The interest has been clear, and the demonstrated value has never been more clear for diagnostic tests. So we see the whole ecosystem as being enlarged and more robust than ever before.
Will the venue that we've become accustomed to, both in the caregiver side, either in the hospital or centers of care, and it seems that health tech and med tech, because of this, has gravitated a bit outside of the conventional historical centers of care to home care, to testing in remote areas. And that has been empowered in part by logistics, but also empowered in part by Tim and Danelle, as you pointed out, by technologies. How are we as an agency and as an organization at whole, MDIC and the FDA, how are we making sure that what we've brought to the table today in the middle of this pandemic will indeed carry over from a safety and accuracy perspective moving forward? So Tim, bring us out of that.
Sure. I think one of the very clear innovations and demonstrated success during the pandemic, and I believe which will be carried on for other diseases going forward, is home testing and patient self-collection and or home collection. So we've authorized 5 complete in-home tests and the first molecular test to ever be authorized for use in the home. And we've also authorized more than 50 different, made different, 50 different, more than 50 different authorizations for home collection. And that was in the area of respiratory disease or other sexually transmitted disease or other infectious diseases, was essentially, as far as authorizations go, zero. So I think we've shown just a glimpse of what's possible to expand access to the home and non-traditional settings in the ways that patients are involved in their own healthcare. And the technology that surrounds that, we've just seen the very beginning. I think it's certainly demonstrated very clearly that this is the future, or at least a big part of the future of medicine.
In that home care environment, Danelle, and on the same back end of the answer that Tim had shared, in that home collection environment, right? Historically, we've always worried about bad sample means bad data. Have we introduced a new protocol? Have we introduced new technology? How do we guard against that when now we're testing in the millions at home, where maybe that wasn't the case other than a 23andMe protocol previously? How are we making sure that in this infectious disease market and world that we're giving as accurate an outcome as possible when we're leaving it in a layperson's hands?
I think whenever you're dealing with a layperson, you have to look at your instructions for use and how you're instructing that person who's taking their own sample. I actually had an experience where I did an at-home collection, and I was given online video that I could go to, made it very, very easy, that showed me exactly what to do. It's a non-traditional way of instructing on how to collect samples, and you have to think about who is my end user here. And in this case, it's, the end user is the individual, and you need to give those very simple instructions. I also noticed that we went from, if you think about the first tests out were nasopharyngeal, high quantity, high accuracy, et cetera. And we had to, throughout the pandemic, adjust throughout the phases to reach those home tests. And so you also saw a change in how you collected the test. If we had asked a patient at home or an individual at home to do their own nasopharyngeal swab, my bet is it would not have been near as easy as doing a simple, nasal swab in each of your nostrils. So you think about that, and how do you simplify the test? How do you simplify the collection, and how do you provide instructions for use that anybody can understand that's doing it on their own?
Interesting.
Yes, I would.
Go ahead,
if
Tim.
I could add on to that, yeah. I agree with Danelle, and it's truly amazing that we've demonstrated during this pandemic that we can take technologies that were originally intended for healthcare settings. They might be in CLIA-waived labs in clinics and performed by non-laboratory professionals, but still healthcare workers, and for which we would expect reasonably accurate results. And then move that into the home, and we see essentially the same performance in the home that we see in these point of care settings performed by healthcare workers. I think that was a huge question for a lot of people, whether we could bridge into that situation. I think it's a testament to the technologies and the robustness of the technologies that have been submitted to the FDA and we've been able to authorize. And I would add that, I don't know that you could have picked a much more difficult analyte to detect. First of all, it's a sample type that patients aren't used to collecting on their own. Also, the virus is sometimes hard to detect because the levels may be low, even early in symptomatic disease. And then you've got to make it simple enough for home users to do and perform, and so we really challenge the system. There are much easier things that can be done in the home than this. So demonstrating this is huge.
So I'm going to combine a question here because I think it's appropriate for where we are. Danelle had used the term earlier, personalized medicine, which I think is going to be a rapidly emerging, self-empowered with the public. And then you combine that with access, the importance of access, and then this rapid rate of innovation that's taken place. And so now we have this convergence of empowered personal care, access, and then innovation, as simple as maybe an iPhone or something like that. How important is that moving forward? And would all of that been accelerated at a rate if we had not had this pandemic? Danelle, you want to start with that?
As we look at the development of technology and how it's accelerated, over the pandemic, I don't think it would have accelerated as quickly. Certainly, we had the technologies out there, the technologies were in the pipeline, but we were forced to compress. And most of the developers were doing this. You were compressing years of development, research, development, and commercialization into sometimes weeks or months. And so that level of innovation really came from the pandemic itself. Where do we go forward from this? I think that, you have the use of platforms such as mobile telephones that can do, so much more now than ever. And if you think about, I think somebody said you could almost do what you do in a lab on your telephone. Telephones are doing diagnostics. They're also just doing displays. So we have a wide range of technology with complexity in some cases, simplicity in others. And you have to start looking now at what are the intended uses. Where the challenge comes in is innovation is moving so quickly, in part because of the pandemic, in part because of what already was growing with artificial intelligence and machine learning and predictive analytics and all of these various things that were being used or considered in the diagnostic space. And now we are challenging our regulators with using what has been a traditional device approach in many countries to how do you now regulate this incredible new technology? And so I know Tim's team is working on this now, and most of CDRH is how do we deal with this going forward in a way that we can allow this innovation to move and move quickly so that we can, innovate our entire healthcare ecosystem at the same time, ensuring that the products out there are safe and effective.
Tim, thoughts on that subject?
Yes. So they say that necessity is the mother of invention, and that's I think never proved more true during this time. It is part of what we do in the Device Center is to try to anticipate needs and look into the future and prepare for technologies that are going to make a difference and start actually collecting experts inside and outside the FDA in order to assess this need. Now, with MDIC, we do that all the time, and we do that internally to the FDA as well. So, I would say very few of these ideas were entirely new to the FDA. However, it certainly sped up our thinking and how to deal with it. Now, thanks to the emergency use authorization law, we have greater flexibility in authorizing products during an emergency such as this. So we don't need quite as much data to make our decision. And that also allowed very quick innovation in getting things onto the market to support healthcare efforts to deal with this pandemic. And then we gain even more information when these are on the market about their capabilities and how we can further expand these technologies. So when it comes to, say, to digital health or mobile technologies, it has played a huge role. We had efforts on reporting that were initiated well before the pandemic, coding, in particular microbiology diseases, for digital reporting. We had set up entire codes for the known diseases, and we added them for SARS-CoV-2. And then, the U.S. government is using those codes for reporting now. And now software developers, smartphone app developers are using all of this to help us stay in touch with what is going on in the community, what is happening to, are the infections in a given community going up or down? This is just the beginning of this kind of capability. And in the end, we're going to be able to manage all diseases much better based on these technologies going forward.
So COVID has obviously shifted the diagnostic from the lab to over the counter as given with a respiratory disease. Do you see other diagnostics coming about for other infectious diseases being approved for OTC in the future? Because I know historically those have been difficult assays to deal with prior to COVID. So does this open the door for a broader range of access because it's OTC, and especially might be important in certain communities where transmittable disease could lead to other sort of situations in the health system? Tim, you want to take that?
Sure. Well, we were absolutely open to these kind of advancements prior to the pandemic. We had actually, say, on home collection, dealing with a number of interested parties, figured out a pathway to authorize home collection, and we immediately applied that when the need arose during this pandemic. What I think has happened is that clearly everybody understands this can be done, so there's perhaps more openness to it. And I'm talking outside the agency, and for things like reimbursement and the fact that it can be done accurately, and also the technologies that are developed for this pandemic, many of them can be easily adapted to other respiratory viruses, such as flu, which is an annual infection that kills in a normal year. We haven't had a normal year the last year, or we probably won't have a normal year this year, because of everything that we've done to try to restrict contagion in this pandemic has actually really cut down the amount of flu. But there will be a need in the future for other respiratory diseases like a flu to test for and test for at home. So I think all these advancements will come fast. All that's needed is data to support its use in the home, and the FDA will authorize.
Danelle, question, because you're on the commercial side, not necessarily in the FDA. When we start to think about subjects that have come to the forefront of real world evidence and massive data sets, and now being able to deploy perhaps over the counter with some of these testing, how does that change your strategy in the role that you sit in on the commercial side of the world?
When we're looking at our strategy, we're looking at what can we do for the patients. And so with COVID, for example, I think we had about 16 products available throughout the world, ranging from PCR to rapid antigen to digital health programs. And essentially what we were looking at is what do we need to reach the various groups of individuals that really need to be tested, and how do we address this pandemic quickly? So we're looking at a broad range of different types, whether it's near patient testing, OTC, or in the lab. And I think you're always going to need, the high quantity, high accuracy tests in the lab, but you're also going to need the point of care and the OTC. And so we're looking at how do you do it all? How do you have those offerings, that breadth of offerings that are going to do what patients really need?
and there's many dynamics involved in that when you start to move to the outside communities, right? You have connectivity issues, you have the ability to even access an over-the-counter test, and you sometimes have competency challenges, you have different languages, you have all of these things coming in. So some of that is technology, some of that is social infrastructure. So it's a fascinating subject that I think until March of 2020, IVD from most people's perspective in the medtech world was like, now it's become really the tip of the spear. We realize that this is something that we've got to get from a reactive perspective, but also from a playing defense as an offensive move in this personalized care, as you used that term earlier. So I appreciate it.
I think honestly, it's made science sexy, right? It's made it so that you can look at the science, and these scientists who are frankly so much smarter than I am looking at all of these different types of tests. It's just amazing. It's just amazing. There's heroes all around.
I agree 100%. I've said it a number of times in the podcasts I've done with some of the most amazing guests like yourself. I'm like, yeah, it's cool to be an athlete or an actor or somebody else, but look who saved the world this time, a bunch of scientists. So is there anything we didn't cover that I should have covered before I let you get back to preventing another pandemic and helping us save the world? Tim, from your side, the FDA and your role, is there something that we should be keeping our eyes on, programs coming out?
Well, certainly there's a couple of things. One is that the investment by the U.S. government in new technologies during this pandemic, for example, the RADx program, has been a tremendous success. It has ramped up production, has brought new technologies into the home, and was absolutely critical to seeing the innovations, to some of the innovations we've seen. And, U.S. government involvement in these types of technologies going forward would be very welcome. The second is, and it's related to that first, is lessons learned. And so Jeff Shuren of CDRH and myself have published a number of pieces on this across the various technologies and where testing is performed. Going forward, preparing for the next pandemic, we see, some focused investments to get set as being very important. It will also include establishing international partnerships to share access to clinical specimens as early as possible, as early as they become available. That was one of the things that hurt us in the U.S. early on, is we simply, for test validation purposes, didn't have access to actual patient samples, and we pivoted to allowing contrived samples and even artificial samples that were made in vitro in order to validate the early tests. And then we see a value in the U.S. government getting involved in evaluating these tests. We had an issue with serology tests where some of them, many of them, were not performing to expectations. And we formed an interagency effort, including some academic partners, to access samples for testing serology tests at NCI, and involved the CDC, NIH, and the FDA. And it was a fantastic program, and it really does demonstrate the value of an independent evaluation. So there are really so many lessons learned here that we're going to apply during this current pandemic to future pandemics and preparedness for it, as well as for hopefully non-pandemic sort of diseases, and I think that can really advance healthcare much more quickly.
Yeah, and you bring up interesting point is within our borders and the FDA and the scientists who work in our country, pandemic is borderless, right? And I think that hit everybody in the public domain more than ever. Is we can do a great job on our side eventually once we have the right tools and the right items to track, but we can't always count on activities outside our borders that definitely will impact ourselves inside our borders. So I'm glad to hear those collaborations and partnerships going on. Donnell, from your side, before we close out, anything we should keep our eyes on and you would like to have the public be aware of? Because now people are paying attention to transmittable diseases.
Good. Yes. I just want to make a couple of points. First is about the access to real world data. Throughout this pandemic, I think that there was a lot of discussion about how do we know whether these in vitro diagnostics that are out there work. And part of the issue is that IVDs are not coded and available in health records like a lot of other devices are. So with the emergency use authorization, you don't necessarily have a UDI. And even if you did, they're not programmed into health records. It's often just unstructured data sitting in a PDF that doesn't even have the name or brand of the diagnostic that was used. So as we look forward, we need to look at how do we get unique device identifiers or some other form of identifier along with LOINC, which is a specific IVD code, so that the data elements that we need to have to know that these really work are there and they're programmed into the appropriate records so that we can get to those. And it's not just, when I say we, I mean, the regulators, the industry, et cetera. MDIC has made tremendous inroads working with the FDA and industry to develop a framework on use of real-world evidence for IVD regulatory decision-making. But if we can't access the data, then we can never get to that point of using, for example, real-world evidence to get an approval for a test. The second point that I wanted to make is that I can't go through this entire discussion with Tim without absolutely applauding his team. His team has worked tirelessly over the last year plus to get hundreds and hundreds of EUAs reviewed and to ensure that the products that are out there actually work. And so, Tim, you've done a tremendous job. I know your folks are incredibly tired, but we in industry and those, and patients, those of us who have known people with COVID, we so appreciate the work that you guys have done.
Really well put. Really well put. Well, Tim, thank you. Thank you so much. Appreciate you taking the time and the FDA supporting this. Donnell, thank you as well, and MDIC supporting this. I do appreciate the time and the conversation and certainly the education of the public who will appreciate this as well. So it's been a pleasure to chat with both of you.
Thank you.
Thank you.
I'm Joe Mullings from 160 Studios. Be well.